Hello, and welcome to the Clinical Care Options Podcast. I'm your host, Sarah Anderson. In this episode, we will be hearing about the patient experience with cholestatic pruritus and primary biliary cholangitis, or PBC. For this episode, I'm joined by Dr. Stuart Gordon from Wayne State University and Henry Ford Health System, Dr. Marlyn Mayo from the University of Texas Southwestern, and Brenda Remo, a person living with PBC. For more information about this program and to follow along with the slides, please visit the links in the show notes for this episode. And to get access to all of our new podcast episodes, subscribe to the CCO podcast channels on Apple Podcasts, Google Podcasts, or Spotify. Now, let's get started and hear from Dr. Mayo.
Today, we're focusing on the patient experience with cholestatic pruritus in PBC. Cholestatic pruritus is pruritus or itching due to cholestasis or impaired bile flow. And although we're focusing on PBC today, it really can be from cholestasis of any origin. That includes extrahepatic biliary obstruction or other cholestatic diseases like pediatric conditions, progressive familial intrahepatic cholestasis, or cholestasis of pregnancy. Any cholestatic disorder can lead to itching. PBC pruritus is indiscriminate. It can affect absolutely anybody who has PBC. There was a PBC Foundation survey of almost 500 patients in which they characterized the itching and found that it affects both sexes equally. It was present in all ages of patients from 31 to 70 plus. The itching in PBC does not correlate with the amount of liver disease, any lab values, how long they've had the disease. It is not a marker of disease severity. And interestingly, patients mark the severity on a normal day similar to in severity as they do on their worst day, which tells us that it's not just the severity that goes into determining somebody's worst day, but other characteristics such as how much it affects maybe what they are planning to do that day. And you see a patient description of PBC pruritus, and this reflects what I've heard from patients repeatedly, which is that the itch is more than just itch. Itch is days and days of torture, thousands and thousands of ants and spiders crawling under your hands, your ears, absolutely everywhere. The thing about itching in PBC is it has a really profound impact on quality of life, and this is multifactorial. So the itch, which tends to happen more in the evenings than during the days, really interferes with sleep, and so patients can become sleep deprived. PBC alone can cause symptoms of fatigue and brain fog, which you can imagine when they're sleep deprived. This also can make the fatigue and the brain fog worse. Feeling itchy all the time and exhausted can lead to depression, and all these symptoms can lead to inability to work. And these are just some of the ways in which the itch can affect the quality of life of patients with PBC and how these effects interplay with each other. This study shows a summary of the health utility of cholestatic pruritus. If you're not used to thinking in terms of health utility, it's a scale where 1 represents perfect health and 0 represents death. You can see a graph of different disorders and how much they impair quality of life. And having liver disease alone, such as hepatitis C or PBC, results in a reduction from perfect health to about 0.9. But as you add the symptom of itch and worsening itch, health utility declines significantly. And then if you look at other chronic diseases such as COPD or end-stage renal disease, those are around 0.7. But patients with PBC and severe itch really have impressive reduction in quality of life. Their scores average about 0.5, which is on a par with patients who have severe Parkinson's disease. So cholestatic pruritus has a negative effect on health-related quality of life and health utility, and the impairment of severe itch is really significant if we compare it to diseases such as Parkinson's. So now we have the pleasure of introducing to you our patient representative, Brenda, who has been living with PBC for several years. Brenda, when were you diagnosed?
I was diagnosed in April of 2021.
All right. And have you had to deal with this symptom of itching, or is this just something you've heard of from other patients?
No, I deal with the itching every day. It's awful. The itching is out of control. I relate it to fiberglass. Like when you touch fiberglass, how you can scratch, but the itch doesn't go away. When I compare it to people, I say it feels like fiberglass, that itch that you can scratch, but you're not really touching that itch.
Right. I've heard that from other patients, that they feel like it's under the skin, and then they scratch and scratch until they bleed, but they just can't get to it, or it doesn't, relieve it.
Right.
Can you tell us a little bit about things that seem to like make it worse or better? Does it come and go, or is it just there constantly?
It flares. I would say it's pretty constant that I'm just scratching somewhere, but it does flare. Heat makes it worse. I live in Arizona, so the summer is hellacious.
We've heard that from so many people. I had a patient recently who thought that her dogs had fleas. She had a couple of dogs and she was feeling this tingling about her legs, and she attributed to some sort of a bug or insect. And I think
Right.
it's recently that people have made that type of analogy of ants crawling and bugs and that sort of a thing.
Yeah.
We'd previously heard it's a itch that won't go away with scratching, but it's a living type of experience. So tell us any parts of your body, any sort of, locations or times of the day.
It's really everywhere on my body. I will say the one place I don't experience it a lot, which I'm very thankful for, is the bottom of my feet, which when it does happen, it's awful. You can't focus on anything else. It's just bad. But other than that, you just you deal with it. You go to the doctors and they just say, well, that's part of liver disease. And they give you the medicines for it. Like I am on the cholestyramine. That stuff's hard to take, which adds just another layer of just issues,
Right. Why do you say it's hard to take?
Because it tastes like you're drinking orange sand. And it doesn't matter. Like, I want to say the directions say 6 to 8 ounces of water. You don't really want to add more water because it doesn't help. And then you just have to drink more of it. It's not pleasant. And now I'm at the point where I have to take it twice a day, and it's really hard because of the spacing of that medicine. You can't have anything 4 hours before or 4 hours after. And so when you're taking it twice a day, that right there is taking up a lot of time in your day. Plus you have your other meds to get in, and it's a lot. It's a lot. The itching consumes a lot of your life.
So we're going to be talking a little bit about treatment a little bit also, and we're here about the fatigue, the sleep deprivation, the social, the emotional. Maybe you can sort of articulate for us a little bit about some of those factors as well.
PBC is life-altering. I'm not the same person I was 3 years ago. When I was diagnosed, I had bruising and I was tired all the time. I was a mom of 2 kids. What mom is not tired all the time? And then it's just progressively over the last years, it's just gotten worse with the itching, with the brain fog. It's not just this little disease that is really no big deal and doesn't really affect the quality. I just feel like healthcare providers did it as, oh, itching and fatigue. Oh, big deal. No, it's more than just itching. It's like unbelievable itching. And it's more than just fatigue. Like I wish I could have a normal person fatigue at this point. But there's some days you wake up and you base your life on the amount of energy you wake up with. And I've had days where by the time I get out of the shower and get dressed, I'm done. I'm not going out. I've spent my energy for the day. So it's tough. It's a really tough disease. I'm really glad to see the attention it's getting now, but socially it affects everything because you're either tired or you feel, self-conscious of itching. I've been in grocery stores and walked up to pools and just scratched on a pool like I was a bear and probably looked like, I was on drugs to half the people in the store, but I just didn't care. I had to get the itch away. Yeah, I'll wake up some mornings and I can just, as soon as I open my eyes, I know that I slept with Freddy Krueger that night. And I will just wake up with just claw marks that it hurts. It's a daily struggle.
I can only imagine. That's a powerful story about being in the grocery store and fearing that people think you're on drugs or that there's something else, wrong with you.
Yeah, he's like, what are you doing? And I'm like, I just have to. And he just laughed and kept, moving across. Well, I scratched on a pole like a bear. Like, I don't even go to the grocery store actually anymore because it's exhausting. It's exhausting trying to load the groceries in the car, never mind then come around and get them into the house. So, like, we do our groceries online now. It's life-altering. It is extremely life-altering. And I don't think it gets the attention that it needs.
Thanks. Well, that's why we're doing this program, to try and increase physicians' awareness and the public's awareness of this really debilitating symptom. Since you mentioned it, what has been your personal experience with healthcare providers and other people recognizing, or maybe recognizing but not understanding or giving enough weight to these symptoms that you described that are altering your life?
It's horrid. My PCP that originally found the diagnosis was wonderful, but then she left, and it's been difficult trying to find someone that even knows anything about the disease. I actually had a PCP tell me, well, you have an autoimmune disease, not a liver disease. And it's a lot of going into doctors and, or you'll go to the emergency room for something and what's your history? I have PBC. PB what? Primary biliary cholangitis. What is that? Well, I apparently can treat myself better than you can at this point. It's a lot of that. And now I'm with a hepatologist. I do really like him. He knows I have the itch. He says that's the biggest part of liver disease that we don't understand. So it's just kind of deal with it, I guess, is kind of the way it comes off. It's just kind of like the fatigue and liver and itching and liver disease. We just don't get that. And then you move on. But it's like, there has to be something, and as a patient, I feel like if it was their mom or their sister, they wouldn't be stopping at it's just fatigue and itching, deal with it, because it's miserable. It's life-altering. And I don't think there's enough education, and I don't think providers get it.
Right. Unfortunately, I think you're somewhat correct in that, speaking for healthcare providers, that we don't all get it.
Thank you very much to our panel of experts, and thank you to our listeners for joining in. As a reminder, to view the full program, More Than Just an Itch, the patient impact of cholestatic pruritus in PBC on the Clinical Care Options website, click on the links in the show notes for this episode. And to access all of our new podcast episodes, subscribe to the CCO podcast channels on Apple Podcasts, Google Podcasts, or Spotify. Thank you and have a great day.